Abrasions, corneal abrasions or mechanical trauma. Descriptions. A corneal abrasion is a superficial injury affecting the epithelium, but not involving the underlying stroma. Symptoms usually occur immediately, and the underlying cornea is relatively clear and free from inflammation. While the patient may be aware of the cause of the injury, such as fingernails, in others' case it may be post-operative or idiopathic. Now, other causes of epithelial defects could be chemical burns, which effect of acid or particularly alkaline on the cornea can be potentially devastating and represent an ocular emergency. A flash burn arises due to electromagnetic radiation, either natural or artificial. Foreign body could be organic material embedded in the cornea. For example, from gardening carries the risk of infections. And some metals cause persistent inflammation. Contact lens. Corneal abrasions related to contact lens wear carry the risk of bacterial keratitis, particularly with Pseudomonas. Especially with poor patients' compliance with the lens disposal intervals, solution expiry date, or contact lens case hygiene. Could be a penetrating eye injury. Imaging and/or hospitalizations may be indicated if the patient has been using power or garden tools that may produce a high-speed projectile, or if there is trauma related to a sharp tool or weapon. Recurrent corneal erosion syndromes or other idiopathic conditions. A toxic keratitis with corneal epithelial disruptions and mild anterior eye inflammations related to a toxic substance, medicamentosa, anesthetic abuse, or foreign matter. Symptoms. As the cornea is highly innervated, an abrasion usually causes acute pain. The patient will usually clearly recall the nature of the traumatic incident. If the abrasion is over the central cornea, vision may be impaired. The patient also frequently reports blurred vision, photophobia, a red eye, slight ptosis, and increased lacrimations. Signs. An abrasion is a clearly delineated epithelial defect that stains with fluorescein. Abrasions are graded according to the size, the locations, either central or peripheral, and effect on visual acuity. The underlying corneal stroma is usually relatively clear and free from inflammations or infiltration, although in large abrasions there may be underlying corneal stromal edema. The anterior chamber is usually quiet. Management. A simple corneal abrasion is self-limiting and will heal in 1 to 5 days, depending on the extent of the area affected. Management is aimed to improve patients' comfort and to ensure there is no secondary infections. Therapeutics. Antibiotic. A broad-spectrum topical antibiotic QID is indicated until epithelial healing has occurred. While the ointment form is probably more effective, drops are often adequate. Ice packs and oral analgesic may also be indicated for pain management, but patching is rarely used. Cycloplegia with hematropin 2% to prevent ciliary spasm may be indicated for larger abrasions or if there are signs of an anterior chamber reaction. Bandaged contact lenses are also sometimes used for larger abrasions to promote comfort and healing. They require prophylactic antibiotics as above and regular follow-up. Advice. Risk factors for infection should be managed. Avoid contact lens wear and review patients' compliance with lens care. If the injury arose from gardening or pets, there is a risk of subsequent fungal infections, and in a hot tub, the risk of acanthamoeba. A review. The patients can be reviewed in 48 hours. Normally, there is improved patient comfort and signs of healing evident within 24 hours.